This is Wuhan Gymnasium. For weeks, over the height of the pandemic in China, it was all medics and patients. 15 other temporary hospitals like this were converted from public facilities in Wuhan to treat mild cases. They prevented infections from patients who would otherwise have been sent back to their homes and communities. There was no time to lose. Nails were hammered directly into this wooden floor. 1,100 beds were wheeled in. Basic necessities were piled up in the corners. 700 medics were deployed in the battle of life and death. Elsewhere in the province, 32,000 medical workers from 29 provinces and regions poured in. Their specialties range from respiratory disease, infectious disease, and critical ICU to cardiology and neurology. More than a third of them were under the age of 30. Guangdong was the first province to send help as early as January 24th. Initially, there were doubts from outside. Was proper care being given? Would putting so many sick people together increase the risks of cross-infections? And then there were complaints here over power outages and heating failures. But the measures worked and saved lives.
你看我们今天是不是又是豪华晚餐呢？
Over a month later, all these venues closed as the number of cases plunged. And the model was also adopted by other countries and regions. After building a negative pressure ventilation system and several rounds of tests, this stadium reopened to the public in May. During the National Day holiday, a charity basketball game was played here. Some of the medical workers and volunteers were invited back. But the experience has left its mark. This venue here, like all the others that helped COVID patients tide over the worst, stands ready for any future emergency as the winter continues.